I will call this meeting to order. First of all, we'll introduce ourselves. My name is Kay Leach, and I'm serving as chair for this Monroe County Board of Health. And I'm going to ask the board members then to introduce themselves. And George, if you'll start.
Hi, I'm George Hageman. I'm a retired microbiologist from IU, and I've been on the board many, many years. I think almost, maybe a little less or more long than Carol.
We never get a number, but we know it's been many years. Next is Mark.
I'm Mark Norrell. I'm a senior lecturer in healthcare management and policy at Indiana University.
And then Steve.
Hi, I'm Steve Pritchard. I'm a retired dentist and longtime board member. Not as long as George or Carol, though.
And then Carol.
Carol Tulukian. I'm a retired pediatrician. I've been on the board for a hideously long time.
And then Bob.
Dr. Robert Wren. I'm a retired OB/GYN. I've been on the board about 5 years.
And that's the board members. And then the administrator for the Monroe County Board of Health is Penny. Penny, would you introduce yourself?
I will introduce myself. I was just setting the camera to come on to Dr. Sharp and you went to me first. So Penny Cottle, I'm the administrator at the Monroe County Health Department.
And actually right now we can't see. Oh, there you are, both of you. Okay.
Yes, we're trying not to get too close. But anyway, I'm Dr. Sharp and I'm the official title is Commissioner of Health or Health Officer, and for many years.
Good to see both of you. Okay, and then our legal advisor, Margie Rice. Margie, are you here? Yes.
I am here. Yeah, I'm having some internet instability, so I'm going to keep my video off. But yes, I'm here, and I'm happy to join you today.
Thank you, Margie. Okay, next on our agenda is public comment. If there's anyone in the public that would like to bring an issue to the board, we welcome it. So if you're out there and you want to make us aware of an issue, please just raise your hand, go down to the bottom of the screen under reactions. And then in there, you can raise a hand and our technical person, Michelle, will let us know that you're out there. So if there's any members of the public that would like to make a comment, please let us know. Michelle, do you see any hands raised out there? Is Michelle with us today, Penny?
I am. I'm sorry. I've been having some trouble hearing you. Your voice is pretty soft. Can you go ahead and repeat that for me?
Yes. Do you see any hands that's been raised?
Nope, there are no hands.
Okay, then there's no public comment at this time, but I'll try to once again have public comment near the end if anyone wants to chime in with something. Next on our agenda is the approval of the April 6th meeting minutes. And we did get those just a short while ago. Have you had a chance to look at them?
Yes.
Anybody see corrections? I think I found a couple. Anybody want to start with them? The couple I found was on page 2 under communal living regulations. Paragraph 2, it says, after discussion, a motion to allow for an exemption process that may allow up to 90 capacity. I think we mean 90%.
Yeah, that's a typo. That's an easy one to fix.
And then in the next paragraph, I have a question. On the second sentence, it says health department staff presented language recommending that a house that is not in yellow or red. Do we want to say yellow, orange, or red? Do we want to say orange?
No, orange does not exist.
Oh, it doesn't exist anymore.
Well, this is particularly for IU and our metrics for the organizational houses, and they have a yellow and a red status and a green. So green, they're good to go, but it's yellow and red with restrictions.
That was my question.
Yes.
Anybody else find anything else? Do I hear a motion?
Except as written.
And I'll second that.
Okay, a motion's been made and a second. Let's vote on it. First is Hageman,
Yes.
Norrell,
Yes.
Pritchard,
Yes.
Tolukian,
Yes.
Wren,
Yes.
and I also vote yes. So minutes stand approved with the change. Okay, next on our agenda is public health reports. First of all is listed as administration. So Penny, that's you.
Sure. I just have a few things that were kind of outside to give you an update on. Senate Bill 5 is on the, as I understand it, on the governor's desk. We're awaiting action from him if he does, and I believe tomorrow is the deadline, if my dates are correct. And if he does nothing, it will go into effect. If he vetoes it, it will go back to the legislators to override, as they have indicated that they will do that. So we have prepared, the commissioners last week approved our regulations. They're putting in a process for any hearings that may need to occur. So we are on top of that when that goes into effect, assuming that it does. We have put in the outlines for job descriptions for the 2 new positions. I kind of updated you last meeting on that as well, but those have been completed. They have been sent to Wagner, Irwin, and Shealy for review and development. And we are hopeful that we will have some job descriptions back in June, and then we will complete that process, which will include going to council and requesting that we be able to fill those positions this year. So hopefully by summer, we'll be able to have those positions advertised and hired. I don't think they will be extremely easy to fill because they do require a lot of experience, and we'll see if we have internal interest and what kind of external interest we have as well. The community health assessment is underway, and I think all of you received the link. And I know Chairperson Leach had said that the original link that I sent you kind of didn't work, so I resent that. And if I confused anybody by that, I apologize. But we are encouraging everybody to fill out that survey. One thing that I did want to mention about our harm reduction program, I just received an email today kind of updating this. And you know that we get some funding from the Health Foundation of Greater Indianapolis. I always want to rearrange their name a little bit. And if you recall, we were part of a video series that they did about harm reduction. I think that we sent that to you early last year. And they received an Emmy nomination. So they were notified last week that their 9-part harm reduction video through a collaboration between the Indiana Department of Health, WFYI, and the Health Foundation of Greater Indianapolis, and participants like us, people with harm reduction programs, contributed to, were nominated for a regional Emmy Award. And it is for the Lower Great Lakes chapter of the National Academy of Television Arts and Sciences for societal concerns. So just wanted to let you know that something we were a part of was nominated for an Emmy. So that's kind of interesting and fun news to share with you. The other information that I want to share is just some updates on vaccinations. We have, and Michelle, those flyers that I sent you, if you can run through those while I'm given this information, that would be wonderful. We have a clinic this Thursday at Crestmont. It's one of our outreach clinics. And that will be May 6th from 12:30 to 5:30 at the Boys and Girls Club. And we have had staff and volunteers out last weekend going door to door, trying to encourage people to come. We have yard signs and newsletters and Facebook groups, all kinds of ways that we are sharing that information. And then what you're seeing there is a flyer that we have for our Latinx Hispanic outreach. That is planned on May 10th and June 7th. And that will be at the convention center. And we have had wonderful partnering on this, and all of the individuals in there are people who are service providers or others who are part of the community who were willing to share that they had been vaccinated. And then they had a flyer just in general about that. And then we updated that for the clinic. So we're very excited about that. We have some other clinics that are planned. We are planning one at Ivy Tech. I'll have more information on that in the days to come. We are working on school clinics and how we can provide vaccination clinics once the 12 to 15-year-olds are approved. So we're already making plans for that so we can respond very quickly. We're anticipating that EUA may come as early as next week. So we just want to be really prepared and are planning for that. In terms of vaccinations with Indiana and Monroe County, we have vaccinated almost 48,000 people are fully vaccinated, and 62,000 have received a first dose. Out of our eligible population, over 37% are fully vaccinated and over 48% have received a first dose. And in Indiana, there is a 92% uptake of full vaccination. So there's a concern about that decline in vaccination uptake and people not following through with their second dose appointments. And for the most part, we are not seeing people not follow through. There's always going to be some of that. And some of it can come because people have changed an appointment time or they're going somewhere else for that. So just because they may cancel an appointment with us or not show up does not necessarily mean that they're not going to be vaccinated. Nearly 2 million Hoosiers are fully vaccinated. Over 4 million doses of vaccine have been administered in Indiana, and over 700 vaccination sites occur. So I share these things with you just to say that our focus is really now on vaccinations. The IU Simon Scott Assembly Hall is going robust. They are finishing up second dose appointments with their students and are prepared to absorb the IU Health site at MedArts, decommissioning later this month. The convention center site has, we're not doing our regular appointments. We as a staff are kind of focusing on those outreaches. And then the Assembly Hall site is sort of our community primary site. And on Friday, they had 3,000 appointments. And I think that was student and public, but they had 3,000 appointments available. So I don't know how many they have today. I know it's less than that, but there are appointments available. We encourage people to make their appointment, help somebody else make an appointment. And we are also taking walk-ins. And reported today by the state is just from one of their days at the Indianapolis Motor Speedway, they saw an increase in people showing up, specifically people who identified as Black or African American, Hispanic or Latino, and other race. So we know that appointments can, while very convenient, can be a barrier for some individuals. regardless of what the issue is, whether it's transportation or concern or what have you. And a walk-in clinic gives people the flexibility to show up more on the spur of the moment. So those are some of the things that are going on to make vaccines more available, more accessible to individuals. You know, we've been at this with vaccinations for just under 5 months. And while sometimes people are saying, you know, we don't have very many people vaccinated, when you think about how far we've come in that short amount of time, without vaccine all being available at one time, we really have come a long way. So we're very proud of the work that we're doing. We continue to see the increases in our vaccination rates and happy that that is occurring. The state website also now contains information on variants that's occurring and the surveillance testing that they are doing around that. So if anybody's watching that information, they may want to continue to check out that variant piece. And if you haven't looked at the vaccine dashboard, that is updated regularly as well. I think that is all I have.
I have a question about Monroe County rates though. So the state records all the vaccines, right?
Mm-hmm.
And so when the students get their vaccine, are they recorded at their permanent address, even if they get it here?
Yeah, it depends. So that percentage is certainly a minimum number of residents who have been vaccinated, because the dashboard is by residency, not by the number of vaccines we've done. So there are students who will and are going through and using their permanent address. So that is a minimum number.
Okay. And then I used asking the students to report it to them when they have their vaccine completed, right?
They do not have a mandate yet, but they certainly will have access to those records because they're giving those vaccines. Yes.
Yeah, but they can the students at this point can still they can voluntarily report it at this point.
Absolutely. Yeah.
Because we don't have any idea what kind of numbers IU is seeing at this point, do we? Separate from the Monroe County.
In terms of vaccinations?
Yeah.
I don't have an exact number, although I think that may be on their dashboard.
Okay.
I know last week, I think they reported they had done 20,000 vaccinations, but that was both public and student.
Okay.
And of course, the students can come through the public side of the site as well if they want to.
Penny, I think I see a hand up from Julie Thomas. I don't know if she has a question for you or not.
That is Commissioner Thomas, so I will take her question.
No, my hand's not raised. Sorry.
Well, I'm sorry.
Thank you.
It's on my screen for some reason. I'm sorry. Okay, does anybody else have a question for Penny?
There are no hands raised.
Okay. I think Amy's with us today to tell us about the clinic. Amy, are you there?
Hello, yes. I don't really have a whole lot more to add to what Penny had. I will just mention that we've, some of the outreaches we've completed. We've been to all of our shelters now. We went to the Monroe County Jail last week and were able to vaccinate 55 at the jail that day. And we're just continuing to try to support our schools. So it's, back to school immunization time. We want to work on that now, not just COVID vaccines. So every Monday, the month of May, we have appointments in the evenings for the students so that parents don't have to miss work. And we will be continuing that through the month of June as well. So if anyone needs a later appointment, they can make that.
I heard something today about the Pfizer vaccine is going to be approved going for emergency approval for 12 to 15-year-olds. Have you heard anything about that? That's only the Pfizer vaccine, right?
Yeah, it'll be only the Pfizer vaccine. And we have meetings this week actually to talk with all the schools about how we can accommodate that need. There are about, I think, 1,100 12 plus kids at RBB and about 5,200 at MCCSC. So that
category.
Yeah, fit that category. So that opens up some more opportunity, and we'll be talking with IU and with the schools and others about how we can help them.
It certainly would be great to get those kids back in the classroom.
Right.
Still getting the volunteers that you need to help with outreach and so forth?
Well, we've been able to hire a few temporary nurses to help with those sort of things. So we've been able to utilize that. The volunteers were, essential at the convention center clinic. But yes, we've been using both of those.
Anybody have any other questions for Amy?
I will just add on that a lot of our volunteers that we've used to at the convention center have now mobilized and are helping at IU at that site, since that is also still technically sort of a health department site. That's a partnership site. And so a lot of our volunteers have went there, and we continue to have firefighters who are helping us. And I guess that's worthy of saying, since this is National or International Firefighter Day. So we thank Monroe Fire Protection District and Bloomington Fire for helping us vaccinate.
And I'll add, both of those departments have been helping us get the homebound vaccinated, and we continue to look at that homebound list every week and do those vaccines.
Is there any way they can get recognized for that, Penny, you know of out there?
Well, we've tried to provide that recognition on our press conferences and such. As there's something else that you have in mind, we will certainly entertain that. We do want to provide something a little later as we get through this for all of our volunteers and people who have assisted through this. We want to have some sort of volunteer recognition when we can all be together.
Good.
Question, how do you arrive at the homebound list? What are the sources of information?
So Area 10 on Aging is collecting that information, and then they have a hub that we can access and get those phone numbers. So then we call and set up a time to come out and get that person vaccinated.
Thank you.
Okay, any other questions out there?
If I might, this is not for Amy, but Penny mentioned on the state website that there was a section for variants. And I just kind of jumped over there and I was not able to readily find that. And I'm I know we've got a couple of members from the press and media, and maybe they're interested in seeing that. I wonder if somebody could pop a link in. I would be interested in seeing that.
Penny,
Penny,
you're
you're
muted.
muted.
Somebody's got to do it. I will see what I can do. Since I'm not at my desk, that makes it a little harder for me to do, but it is on the vaccine. It is on the COVID dashboard. So it is just at the bottom of that, but I'll see if I can't find it and send it directly.
Yeah, well, you're kind of in the meeting right now, but maybe Amy, if you could you look on that and see if you could find the variant section?
I'll see if I can find it.
It's at the very bottom of the page, Amy, if you go to the dash.
Okay. I don't know why I didn't see it, but yes, it's at the very bottom right corner for those who are interested. Thank you. And my apologies. I should have seen that.
Things are easy to miss. Thanks, Amy.
Any other questions for Penny or Amy?
There are no hands raised?
I see another hand up on my screen. I don't know why I'm seeing these if they're not meant to be up. There's a Kate McClory. Do you have your hand up?
There are no hands raised right now.
Okay. It's showing up on my screen for some reason, and it also always seems to be in that box. So, Okay, next is old and continuing business, and that's under regulation review. Penny, I think that'll be you and possibly Margie.
Yeah, and Dr. Sharp, so just sort of as an introduction, been trying to, again, stay focused on the data and the numbers. Certainly our vaccination rates are increasing. So we're pleased, and we continue to work hard on getting those numbers as high as we possibly can. Last week, our case rate per 100,000 was 105. The week prior to that, it was 123, and I anticipate tomorrow it is going to be around 123 as well. It may be 125, so give or take 1 or 2 points depending on when they look at those numbers. So while the numbers are kind of vacillating, they're somewhat stable, they are not declining. So one thing that I did do is reach out to some other health departments that have had or considered other regulations aside from the state. And I just wanted to kind of give you a couple of those just as general awareness. So Tippecanoe County, we always get compared a lot to that because of Purdue. They do have their mask mandate in place for West Lafayette and the campus. Interestingly enough, it is not in the whole county. So I find that interesting. They do not have additional regulations. Ripley County, when they went to blue, they took out their additional regulations, as Hamilton County took those out. I did hear from Fort Wayne and Allen County, which also is in line with the state. And she indicated that they didn't have additional ones, but she was really surprised at the amount of people that seemed to still submit plans. This was true for Tippecanoe County as well, that events still submitted plans. People were trying to follow previous guidelines. So I just thought I would share that with you. So we will remain in yellow advisory this week. And our current health order is in place through May 28th. So there are a couple of options right now. You don't necessarily need to change anything. And I'll let Dr. Sharp kind of address this in a moment, but we have a little bit of time, but there is a new process with the anticipation of Senate Bill 5. When you change regulations, they will need to then go to the commissioners for approval before they go into effect. So the timing will be a little bit different. So Margie and I were talking earlier with Dr. Sharp and think it may be worthwhile for you to plan on meeting every other week just for maybe a quick meeting to look at regulations, see if there's anything to change. In order to get something changed prior to the 28th, we would recommend that you think about meeting, say, on May 19th. And then those would have time to go to the commissioners the following Wednesday. And if you meet on a Tuesday evening, then we can always update the commissioners, but we won't have time to give them something official. And we need to submit that by Friday at noon for it to be on their next meeting. So just kind of something to keep in mind. And then Dr. Sharp, did you want to talk about kind of your recommendations about where you think, I think the thing for tonight for May, we are not recommending any changes at this time. We had been hopeful that we would already be in blue in terms of advisory, and that just hasn't quite happened yet. But we also want to make sure that we're looking ahead and thinking about our next steps so that one, we can communicate that with people, but that we also just are thinking and having these discussions early as opposed to late.
Penny, do we have any demographics showing where the preponderance of cases are occurring? Are they on campus or?
Yeah, they're kind of split. There isn't an exact because there isn't anything in our cases without going into every individual case and interview and looking at if they said they were a student or not. There isn't something that says somebody's a student. So if I kind of look and try to look maybe by zip code or street or something like that, age, there's a mix. And if I had to venture a guess, and I'm going to say this is anecdotal just from my looking, is that it's probably half and half.
Okay. Thank you.
And a question about, what you said about meeting more often so that the commissioners could, perhaps act. With SB 5, is that only if our regulation is more restrictive than the governor's?
Correct.
Or is it any difference at all would then require a commission vote?
I believe it's if it is more strict, if anything is more stringent, we can be less restrictive in Senate Bill 5, if I understand it correctly. And I will invite Margie to always intervene with any legal question.
Yeah, I will let you know that it would be my plan to have the commissioners approve any order that you issue, just to be safe. I think they need, based on the language of the statute, they need to approve your order. So whatever it is you do, I plan to take it to the, and Jeff Cockrell and I plan to take it to the commissioners for their blessing and approval.
Well, if we had a state regulation, how could we be less restrictive?
We can't be.
We can't, right?
No, not less.
No.
Well, it would depend on what the regulation was, right? If the state said you could have 100 people and we were trying to say you can have 150, that would be less restrictive, right?
But how could we even consider doing that if there's a state regulation for that? I mean, why would we consider that?
Why is the question, but yes.
Yeah,
we have Senate Bill 5, I don't know.
Yeah, and real quick, if I can share my screen, I was just looking on the state's website about Senate Enrolled Act 5. So I'm going to try to share. Oh, I'm disabled.
1 second, please.
Okay.
All right, go ahead.
If I can share this. This is dated today. And this says that the governor vetoed Senate Enrolled Act number 5. So I don't know when this, I just pulled this up. I don't know when this was signed and put on the website. It's got today's date on it. So I think this is the latest. It says, by the authority vested in me as governor of the state of Indiana, pursuant to the provision of Article 5, I do hereby veto Senate Enrolled Act 5, acted during the General Assembly. And then he gives his reasoning for that. So we will wait and see what happens. I think the General Assembly is committed to continuing to push this issue, but we'll just have to wait and see. I can make sure that I save this off and send this to you guys as well. He says here in the end, please keep in mind that my substantive disagreement with this bill does not mean that I question all the underlying motives. As evidenced above, he says it's critical that we maintain our local health expertise, flexibility, and all tools needed to respond. And we must not do anything that jeopardizes this, as our heroic local health officials remain critical in the months to come as we accelerate our recovery and work to vaccinate many Hoosiers. So it's been signed. So that's the latest, and I'll make sure to get it to you.
Thanks, Margie. I looked at Senate Bill 5 before I came into the meeting, so that may be hot off the press.
I think it is. I think it just got posted. So yeah, so this just goes to show that things are very fluid. And I think Penny's recommendation that you meet more often, at least until things get somewhat stabilized, is probably a good idea. We need to continue to work closely with you guys and with the commissioners.
Currently, Penny and I discussed this afternoon after listening to the state's report. And our best advice would be to stay in, since we're in yellow, to stay with our current restrictions and not change anything. But when it goes to blue, in the interest of making this simpler, we were thinking that whatever the state comes up with, we would then switch to that if we were in blue for 2 weeks. But we do, so we wouldn't have a mandatory indoor mask, but certainly strong advice that people continue to do what they're currently doing. Just for your interest, this afternoon, the Zoom with the Indiana Department of Health. Interesting that there are occasional breakthrough cases. There have been 893, which equals 0.047%. 31 of them were in the hospital. That's 0.0017%. So it's very rare. There are also 1,531 variants, mostly, of course, the B117. Secondly, a strain 236, that was 1210. 236 from a California strain, 10 from South Africa, and 73 from Brazil. So it's not very many variants. I mean, 1531 sounds like a lot, but it's, considering the numbers, we're not really hit with it like some other places. Also, the advisory, again, if you should consider it anyway. And again, it's our advice that when it does turn to blue, we would, to keep stuff simpler so you don't have to meet every 2 weeks and okay all this stuff, is that we go to what the state says, but then watch and respond to any changes as they come up. We might have to go up and down a little bit, but make things more stringent. But it's probably reasonable after 2 weeks in the blue, with all the immunizations being continued to, they're all continuing to be given, and what case, what immunity people have after having the infection. It's all kind of coming to a head, and so we need to make sure that that people get a psychological reward for the good behavior of all the shots, which is a more open situation. And as you know, in Florida, they've been open a long time, and they're not any worse off than some of the people that were closing down everything. But there are a lot of reasons for both of those. So anyway, we also, every time we meet, which is several times, we talk about people asking for exceptions, and we kind of go through each case, I don't know, 10 or 15, 20 a week, I don't know, weddings, various, the fair and all this. We try to work through all that stuff. So it's not like hard and fast, everybody, here's your rule. It's like, here's the rule, but we'll talk about other things, but you have to come in and tell us what you're doing so that we can decide whether we have any suggestions about how to keep things safer. And again, the overall rule, or the overall aim here, is to keep things as open as we can while still being safe. So it's a fine line. It changes from time to time. We can't really predict it. We don't know what the variants are going to do, but it looks like they're pretty much under control with, the 1,210 of the 1,531 are B117, and the immunization works for that. So, also, Norvax is in clinical trials for kids 12 to 15. And Penny, where did we hear that they're going down as low as 6 months doing trials? now?
Yes, yeah, and I think that may have been the Norvax too.
Was that
but
Norvax? Okay.
Yeah, I didn't print that slide, but yeah, they are doing clinical trials now on them down to 6 months.
I feel sorry for those little kids with all those, oh my God, they're pin cushions with all those other shots they have to get to take it all the way down to 6 months. But so anyway, that's our recommendation for the moment.
Do we know, or have we heard anything about the city? What are they planning on doing? You know, they still have the 15 maximum, I think. Is there talk of any numbers changing in that area?
I do not anticipate that the city will change their number, and I don't know at what point they will.
You know, when we had the meeting where everybody decided that we would go to 25, well, the state was 50. Just arbitrarily, the representative from the city said, well, you guys have done a great job, but it's going to be 15 in the city. And he even said, this is kind of arbitrary. So it's kind of hard to predict what he's going to say but he's made no mention of loosening up.
No, IU did just, or I just got, so IU did put out their summer guidance and their plans. Did I send that to you at last minute? Because I got it kind of this afternoon, so.
Yes.
Okay.
You know, Penny, I just want to throw out one of the things we've been criticized all along for is the fact that we keep changing. And of course, with the color system, we do have to change. But I think we really need to educate or try to educate, you know, what the colors mean and why we're going to that or why we're restricting again and so forth. Because I think the public's going to have a hard time with all the changes.
Well, yes, education and information is always a challenge. And I know the media folks that are on here always try to do, not just try, they do a good job of helping us share that information. And in all honesty, we've not changed much. You know, our regulations have, for the most part, always been stricter than the state. And remain so. We've not, you know, we made a couple changes last time, but very little, and nothing really that the general public would feel, you know, or have to respond to. They were mostly business. But you're right, every time we make a change, and that's one thing I have to tell you is we've kind of talked about looking at the data and what makes sense, and incremental changes are honestly what makes the most scientific sense. Is you make small changes so that you can look and see what the response is to that. But every time you make very small incremental changes with this, it is much more difficult to communicate those changes with the public and the businesses and what, you know, and various entities. You are absolutely right.
There should be some comfort in knowing that what that indicates is that somebody's watching all the numbers and trying to help them out with decisions and give them an idea of how we're doing. If it was just one thing and never changed, that would be a suggestion that we were all taking a vacation until it was over. So we're trying to. I mean, we're trying to keep up with events as they evolve. That's all we can do.
And I do think you've done a fabulous job, that Margie and Penny and you have worked very hard on this, and we've tried to keep up with it. And I'm very happy with where we've been at.
Well, Penny's done the yeoman's work for all this. She's really been on top of this. So
Well, she's
Team
Lady
effort.
of the Year and she's getting an Emmy now.
yeah,
Team effort.
I'm her best cheerleader. But it's really important to have more than one person discussing this stuff all the time. So I don't want to let them wear her down too much. Also, as you can imagine, they try.
Well, I know you've been pulled by all directions, so hats off. Does anybody have any other questions for Penny or Dr. Sharp or anything else under regulation review? Would you like for us to make a motion that we keep things as they are? Or do they just stay that way?
Well, if you take no action, they certainly stay that way. You don't have to take an action to keep them in place. I think having some consensus on where you feel, taking a vote to keep them where they are right now, if that's, the decision is then a very clear action. So there's never any harm in that. And then deciding when you want to meet next to see where we are at that time.
And in the motion, you might make a comment that, or started out with, based on the percentage of positive tests and the number of people per 100,000, based on the statistics and how that comes out as yellow, we're at this time not wanting to change our recommendations.
Okay, I'll make that motion. I make a motion that based on the statistics and the recommendations of Dr. Sharp, that we keep the regulations as they are, as they have been, and to be reviewed at our next meeting in a couple weeks.
I'll second that.
Bob, you seconded?
Yes.
Okay. A motion's been made and a second. Let's take a vote. George?
That would be a Wednesday night.
I agree.
Okay, that's a yes. Norrell?
Yes.
Okay. Pritchard?
Yes.
Ken? Tolukian?
Yes.
Wren?
Yes.
And I also vote yes. So the motion carries. Okay.
George, we appreciated your summary. That was quite good.
Yes, it was. It was very good, George. We're under new business. Any new business, Penny? Anybody?
The only, I guess, new business that I would say is to just ask for any particular input on priorities as we start preparing for the budget. I will tell you that I've lost my paper here, but my biggest request right now would be to add a person in vital records next year. And that is based, we have the registrar, 2 assistant registrars, and we have a part-time person who is paid with local health maintenance funds. And that position was really, it's a data entry clerk, and they were there to kind of assist in vital records. And I have to tell you that over time, they are more and more predominantly becoming vital records and less of the data entry, which is kind of putting us on the borderline of being compliant with that local health maintenance fund agreement, and clearly indicates that they need the additional help. So what I would like to propose in that budget is to add an additional assistant vital records person, and then keep the part-time data entry clerk in our local health maintenance fund. But that would then free them up to continue to back up vital records and help somebody's on vacation or something like that. provide maybe more of a receptionist and data entry and assistance for our other divisions. So for environmental health, those kinds of things. So I think that that could be a way to give us additional capacity, still use the funds that we have. I will tell you that doing that then fills up every workspace that we have. So any additional requests, if there's additional staffing requests to come, then that will have to include some sort of request for additional space somewhere. So just for awareness, I will share that. So that's kind of on my wish list, but open and wanting any feedback that you have as we start preparing for budgets. And I know I have an email in my email box somewhere talking about the budget cycle and what it's going to look like, but I have not even had a chance to open it.
Penny, could I ask that you actually ask other similarly sized counties' health departments about their staffing and whether they have similar numbers of people in the vital records?
Yeah, I can even check the annual reports with that. I will tell you, it's all over the place. And part of that is because I can report back to you on that, what I find, but I will tell you, there are some places where their vital records is part of their nursing division. And, so every county is very different, but I will certainly do that and report back to you.
I just anticipate that question.
Mm-hmm. Yep.
Board members, be thinking about budget, and if there's anything that we have thought about or talked about over the past that we want to include or suggest to Penny to include.
As you know, Indiana does not overspend on public health, just in case you had forgotten that.
Oh, I think we're aware of that.
So getting a new position is, we're inching along. Yeah.
Anything else, Penny?
I do not think so. I think that's it for me.
Okay. Before I go to board member comments, once again, is there any member of the public out there that would like to bring an issue before the board?
There are no hands raised.
Okay, no public comment today. Under board member comments, I'm just going to ask one thing. If there are any agenda items that you would like for us to include on our agenda for the next meeting or something, if there's an agenda item or something you want to bring up, please let us know and we'll add it to our next meeting agenda. Any board member comments? Well, I guess the next thing to do is to look at our next meeting date and time.
Let me add, the health department greatly appreciates the input that you all give us. We don't say it every time, but we just know that that's how we feel about it. You have been immensely helpful.
Thank you, Dr. Sharp.
You've done an immensely good job.
Well, thank you.
They have. Also, that community survey, has everybody gone in and looked at that under Survey Monkey? Maybe it was just me that had trouble with the first link that was sent, because I'm not used to doing the QR code with it, but usually it's when you go into it, it's just there. But I did get into it and I did fill it out. I was a little disappointed that there wasn't a place to make comments, however, and that was my input.
And we will share that. So
It really only takes about 10 minutes or so, or it doesn't take a long time to fill out. So.
Incidentally, I was recently at Assembly Hall. Lots of people over there. They're incredibly organized. If any of you wander through there, I passed out compliments effusively because these people are there just volunteering, and they just they are going way beyond the pale in terms of what they have to do, which is nothing. So there are a lot of people putting in a lot of time over there and doing it. That is so organized over there. That's really good. So
I have to second that. And, I got my fall flu shot there, and they had enlisted the School of Nursing, and it was just, the throughput was amazing. And it's like, I never once stopped except for the 3 seconds to get, and my flu shot was given by a nursing student who I was her 5th immunization she'd ever done in her life.
She actually said that?
Too much information.
After.
Yeah.
No,
TMI.
I asked her, I said, how many have you done? And then I pretended like she had really hurt me when she shot me.
Oh, no.
Oh, Mark.
Yeah,
I bet she loved that.
She knew I was joking.
Yeah,
I want to
I
say
hope so.
too that at the Medical Arts Building, it was the same way. I was probably in and out of there in less than, I had to sit for 15 minutes, but outside of that, I mean, it was just amazing. They were wonderful.
Yeah, and that's how our staff at Convention Center was as well. And I have to tell you, at IU, certainly IU Health as well, but when we went over to the Assembly Hall and just pulling in, I'm like, okay, this is what having more capacity does, right? So they have people who could make those nice signs and put them out, they could stay out, or they have particular people who can put the signs out every day. Whereas when we were at the Convention Center, we and the volunteers were putting those signs out every day and doing and setting up, other things. So it does make us a little envious of those extra resources, I have to say, but we're most grateful for that partnership. And one thing I did think about when you were talking about that, Dr. Hiller had students who worked with us in calling our people with appointments. And we want to give a shout out to them, thank them very much. So the students would call a couple days before the appointment, confirm it, help them finish the registration if it wasn't complete. They canceled some appointments for people who needed to cancel them. That meant that those appointments were then open for individuals to fill. And it was just, it was very, very helpful. We're very grateful for that assistance.
Well, I'm so glad we're planning something for the volunteers to recognize them, because we couldn't have done it without them.
Absolutely.
Any comments before we choose our date for the next meeting? Well, let's look at the old calendar.
You suggested the 19th, the Wednesday?
Yeah, if we do it on the 19th, then we have Thursday to get it prepared and submitted to the commissioners by noon on Friday. So that gives us a little time to do the work that we need to do.
I can do the 19th.
I can do it.
I can do it.
Same time, 4:30?
4:30 works for me. Does it work for everybody else?
Sure.
Sure.
Okay, the next meeting then will be May 19th at 4:30.
Great, thank you.
Thank you so much for being on today, and
You guys have a great week.
as they said this morning in one of my meetings, may the 4th be with you.
Yes, yes. Encourage everybody to schedule their vaccine appointment or show up. Take a friend.
Okay, thank you. You guys have a great week. Bye-bye.
Bye.